I know you can hear me. What's going on? This is the moment where you sing a live song and start singing the Dr. Heavenly song. I can't quite. So what's happening, you two? Can you hear me? Ba da da, ba ba, ba ba da da. Well, we're going to be talking about testing. This is a exciting day for those who are making a difference. I've got Damon and obviously Dr. Heavenly, and they are going to tell us all about their activities in the community. And they are going to come right back. So I'm looking forward to them and making this happen. But for all of us and everybody out there, definitely be sure that you are preserving your health by staying masked up, washing your hands, and enjoying some peace and serenity in the safety of your home. Waiting on my guest, but I've had a great day. It's a moving day. The community has made a difference in all the things that are going on. Maybe we should play you a little music and figure it out. So, for all of you who just really need to move about, you probably want to know your status. For Damon, who's a certified emergency medicine physician, he's launched a bus fleet, mobile COVID testing sites. So we're looking forward to talking to him about servicing the community, being a part of the solution to addressing some of the health disparities that we're seeing as we all think about being and having a seat at the table. Saturday from 12 p.m. to 5, we'll be hosting a first date of Atlanta's famous Word Changes Church International. They're going to be testing there. So if you're looking for a place to go get tested, Saturday from 12 to 5, we want you to go to Atlanta's own World Changes Church International and get your testing done so that you and your family can know your status. It is important that you know your status. That way you will be very loving to those around you, and you will know your status first and only fleet of mobile testing units. So this is a giving access to those who may or may not have the opportunity to literally get tested because money, the cost of moving around, or just not having access. This is a real outreach for those individuals who need the services, and it's great that Damon and Dr. Heavenly both are moving forward in our community to help, to serve, and to care for those in need. Each and every day, we all work to continue to serve this community by providing information. Here at Rolling Out, we have Health IQ, which happens every Tuesday.
Or can you hear us?
Yeah.
Hey, how's it going?
How's it going?
Yeah, me do all this rambling and family rambling and rambling family.
Well, you were doing it, man. We heard part of it, so you were doing well.
Come on, man. I'm sitting here proud of y'all, glad to see y'all. Shoot, I'm just glad to see somebody, you know.
Yeah.
I'm not in these streets. Your wife has been on my Health IQ show. You got to come on there, Doc.
Hey, I'm always willing, my friend. Always.
We finally got it sponsored, you know. We got sponsors, so we can make 2 nickels. But mobile testing, we sponsored a mobile testing unit in Detroit. They did it for individuals in drug treatment centers and homeless shelters. So I really, why don't you tell us about what you have going on? I really think that this is a meaningful program.
Well, you know, I felt inspired. Basically, when Georgia, there was an announcement that Georgia was going to open back up and people were going to go out, I said, okay, great. What's the plan? And I never really heard that part. So, you know, we're pretty proactive. And I felt like, you know what, I can't do it. I can't sit on the sideline. When 9/11 went down, I felt like I needed to do something. I needed to say something, but I didn't. I was a resident in emergency medicine at the time, and I felt like I wasn't significant enough. And I think a lot of people feel that way. Like, well, what's my voice going to do? What's my vote going to do? You know? And I just say, you know what? If that ever happens again, I'm going to do what I felt led to do. So I started Georgia Know Your Status. A couple other companies work with me. Samson Bus Tours and another company working with 23 Consultant, and we worked together. I did all the work in terms of the planning in terms of medical side of it, and we went out. So another thing we're doing is we've gone to different churches. We actually will go to places where people are underserved. So we went to the West End a couple weeks ago and did an event here in Atlanta. I think, you know, we're looking at 23% of all the deaths of COVID are from people who only represent 13% of the entire US population. So Black people are getting really hit hard, you know? So they said, well, Black people have more comorbidities, more diseases, you know, for another word. But that's not it. There's inequalities in healthcare. We've always known that. So we went to those neighborhoods and worked hard. And, you know, we do the testing. We work with anyone's insurance. If you don't have insurance, we utilize the CARES Act, and we're really happy about that because the CARES Act allowed for people that don't have insurance to get treatment. And that's something I think is a bold and great move because we needed it. So we're out here, we're gonna make it happen, and I'm gonna continue doing it because we didn't have a plan. Our plan is test as many people as we can. People know their status. If they know their status, they'll know to quarantine. They'll know to stay away from maybe their elderly family members or elderly friends or whatever, stay away from kids. This is something that you can't really predict what the outcome is going to be. So we took an active role. I decided not to sit on the sidelines this time and jump on it.
That's real cool.
Yeah.
What you say, Dr. Heavenly?
Well, I'm here to support my husband with GeorgiaKnowYourStatus.com. I want everybody to make sure they register for our event. We have an event Saturday at World Changers Church International. Yes, Creflo and Taffy. And we're actually filming the event. It's from 12 p.m. to 5 p.m. on Saturday, July 18th. So make sure you go to the website, GeorgiaKnowYourStatus.com/events and register. It's important that you register so we can kind of get a tally of how many people are coming.
Yeah, and another thing on the registering part. You really need to register. If you look at different events, people are lined up, they're hot in the sun, you know, they need water. We don't want that. We want an organized event where people know that they signed up between certain hours. And if you look at the website, you can sign up in certain hour increments so that you're not having to sit there all day. We want it to be organized. We don't want people to be uncomfortable. This is a service to you, and we want people to be able to enjoy it and get in and get out and ask their questions and stuff like that. So make sure you register, okay?
And make sure you bring your insurance information, your insurance cards. If you don't have insurance, bring your insurance card and your ID. If you don't have insurance, don't worry. Like you said, you're covered with the CARES Act, but you must bring your ID and sign a form that you don't have insurance. So that's all we're requiring you to do. But again, make sure you register for the event, because I know last time we had a whole lot of people out there. We didn't know how many to expect. So at least if you can, go to the website, GeorgiaKnowYourStatus.com/events and register, so we'll know you're coming. And this is a film event. We'll be on Married to Medicine. Of course, your girl, Dr. Jackie, will be there. Dr. Contessa, Dr. Jackie will be there.
Who's
Your
Dr.
girl.
Jackie?
Huh?
Who's Dr. Jackie?
Come on now. Come on now. Come on now. And Dr. Contessa and her husband, Dr. Scott, will be helping out as well.
Good. No, that is my girl for sure. For sure. I think access is what you're talking about, because in my experience of interviewing individuals who have lived to survive off the ventilator, they have all, particularly since they're Black, talked about being turned away and not getting tested, and people turning them away from being tested. So it's very important that our community get tested early so that they can have an idea on the fact if they're positive and actually have COVID, if they could be spreading it. And, you don't want a health surprise. And that's what testing eliminates, the health surprise. And I think this is a wonderful effort for you, Gallant. I mean, and nobody's called till they call. I mean, it isn't that you are less or more. This is your moment. And everybody lives in their moment and lives in their truth. So I think it's phenomenal that you're putting this together. It's another example of Black excellence. That's what y'all represent to me. Here, the seat at the table is all about bringing Black excellence to the marketplace. And that's what you're providing, our opportunity for our community to know. Because that bus driver in Detroit went twice, was turned away twice.
Right.
10 days later, bam.
Right. Well, I have to say that was just
that's a pollen hole.
That's funny, because I was thinking I'm not gonna call for this interview, but I'm not sick at all, and I was tested just a day ago or so, so we're fine. But the thing is, and I'd like to make a call to all physicians: take a moment of your time, educate your patients. I know we're all running and we're trying to make things happen, and we're moving and seeing patients, as efficiently as we can. But the bottom line is, we do need to take enough time with people so we can educate them on what they need to do. Wear a mask, wash your hands. But more importantly, of course you got to wash your hands, but the biggest thing is wear the mask. I mean, they're even making cute and hip masks now, but there's no mask better than the N95 mask. Okay. That's a small pore mask. It's been tested. If you can get your hands on that mask is the most protective. Remember, when you don't have a mask on, how far do you think you need to be away? I'll let you take a stab at it. If you don't have a mask on, how far do you need to be away from another person to really be safe?
30 feet.
You're close, 27 feet. So 30 feet, you're good. Okay, so you actually were right.
So what about the 6 feet?
6 feet is great, but think about it. If you cough, sneeze, sing too loud, raise your voice, then that extends. If someone sneezes or coughs, you got to be at least 27 feet away to be safe. So what do I say? Wear your mask. It doesn't matter what they're saying on TV. Don't wear your mask. It's a violation of it's not a violation of anything. It's if you want to think about it, it's you looking out for someone else other than yourself. And to be non-selfish in today's age is a great thing. Wear your mask for all the beautiful people around you that you don't want to catch anything. You might be one of the lucky ones where you're essentially asymptomatic and you don't know you have it. But that's a lot. If you come around a lot of people, that's a lot of people you could literally kill. There was a guy who was at a choir practice, right? He went in. One guy had the disease, went into the choir practice. Within days, 45 people were positive. 4 of them died. And they were in the church praising God.
Do you imagine that can slow down and reduce these new cases without people wearing masks?
No, sir. I just don't think, what this is showing us is people inherently have a desire to be around each other. what I think has gotten a lot of people anxious is they can't be around anyone. I don't think we can control ourselves enough to stay 27 feet away from each other. We're going to come closer to that. So you know you're going to do that. Wear a mask. Make it easy on yourself. Encourage your friends to wear a mask. All the teenagers out there, wear a mask. All the young adults out there, wear a mask. A lot of the children are home anyway, so it's kind of okay, but you got to do it. If you care about anybody other than yourself, wear a mask.
No, I think testing is key. I think if
Yeah.
you've been out, if you've been moving around, if you have taken risk, you need to show up and be there and be tested this weekend. Because
That's right.
not knowing your status, I mean, I think you're right on it. You have to know your status. There's no reason to walk around, go to a party, go to the store. You haven't worn a mask in the last 10 days and you've been moving around. You need to know your status. You need to go get tested. It's
Right.
time out for that. Like literally, you could be an asymptomatic spreader and literally be affecting and infecting tons of people.
That's
So
right.
I think that having this opportunity is cool. I love the name Know Your Status because I think that gives people an insight.
Well, it's Georgia, know your status. And as we branch out, it'll be Tennessee, know your status, and Florida, know your status, and whatever else, you know? So the thing is, though, the other part of it is COVID is not just the respiratory illness that people think of, okay? COVID is also rapidly progressing blood clots throughout the body. So that makes you at risk for strokes, pulmonary embolus, or PEs, or blood clots in the lungs, blood clots in the lower extremities that can then come up to the lungs. This is a disease that we don't fully understand. There's also an inflammatory process that is kind of similar to something called Kawasaki's disease, where kids, and that one's for young adults and children, can get aneurysms in the heart. Obviously, you're not going to live through that too well with an aneurysm in the heart. So people think, oh, this can't affect me. It can't affect young people. It does. It affects young people. 20 and under can get that disease. Now, not everyone gets it, but it's a possibility. There's things about this particular virus that are complications that we don't even know yet. We're just kind of finding out. We know it increases the risk of strokes and other, bad sequelae, but it's really something that's far more than what we thought,
So I guess the question from Facebook is, how long does the testing turnaround take?
So we're working with a couple different labs, but for our labs, because we chose local Georgia labs that don't have the volume of some of the more national labs, we can turn it around in 2 to 3 days or sooner.
Yeah.
So, yeah.
So you got a fleet of buses. What type testing are you going to do? The antibodies, which testing are you going to actually provide?
We're going to do the PCR test. And that one is we're not doing the antibody test. There's a lot of variance in the antibody test, up to about 40%. Also, we don't know actually that if you are positive and you have the antibodies, does that really confer immunity? And we don't know that yet. So, I'm not suggesting people run out and get the antibody test just yet until we can get better numbers and we know what that means. Is having antibodies the same thing as having the vaccine? Or are you really safe from getting the virus? So we don't know. We do the PCR test, which is a yes or no test with a pretty low false negative rate. So the rapid test that's out, I won't mention the name of the company, but there's a test that you can get your result in 15 minutes, but there's also a 15% false negative rate. So that means 15% of whatever number of people come out this weekend would be sent away with a negative result to find out only later that they actually were positive. So I'm trying to use the test with the lowest false negative rate, which is the PCR test right now. And I know people want to know their result immediately, but just keep on quarantining, keep on being safe, and even after you know your result, that doesn't mean you take your mask off. That just means you can be a little safer when you're around your people in your home and people that you're kind of quarantined with.
And for the lay people, the PCR test is the one through your nose.
Well, it's a polymerase chain reaction test. And right now, that's the most accurate one that we have. We're still working on other tests. I know people know about the vaccine is coming out and they're in phase 1 and we're seeing some good results. I can't advocate it yet because I need to know something safe. And I think all healthcare professionals, all politicians as well, when you're telling people things, don't tell them stuff that's going to get you reelected. Tell them stuff that's going to save their lives, because I just don't believe in lying to folks. If I don't know the answer to something, like if you ask me something right now, I'm going to tell you, I don't know. I'll look it up for you, but I'm not going to tell you a lie. I'm not going to tell you something that I know is not true. There was a statement that was made that 99% of people that get COVID are just fine. That's not true. It's not true. Best friend of mine got it, and he's having symptoms. Although he lived through it, he's having symptoms that he can't explain. And this is somebody I know who's never been afraid or daunted by anything, but this has really shook him up.
Yeah, I interviewed Scarface, and he lost his kidneys. He's on dialysis now. So, the implications are huge.
Yeah.
As it relates to not, Georgia, know your status. If you're in Georgia, you definitely need to know your status, particularly given that it's open. I mean, you can go to the club, you can, do anything you want, shop till you drop. And, just recently, what did you think? Walmart said you got to wear a mask.
That's right. I think that what we're seeing right now is people are being led by other things other than just keeping people alive. And that's a shame, because that's the most important thing. Everyone can talk about whatever percentages they want to talk about, but really that's 100% if it's somebody you love. If somebody you love dies from COVID, it affected you 100%. If it's somebody you respect. And there's a lot of people leaving this earth with COVID that really had a lot more time. We just didn't see this coming. So I just tell people, you don't belong in a club right now. You don't belong in any indoor closed-in event at all. You're best served being outside, but if you're outside, like I said, if you don't want to wear that mask, stay 27 feet away from every single person else out there, or wear your mask. I think this has been a great lesson in humanity. We want to be around each other. You can act like you're a loner all you want, but you know what? We've been in our house for several months other than going to work, and we want to be around people too.
We want to be around each other, baby. That's all all I need.
Of course.
That's all.
Of course. We're around each other. But the thing is, we just want to save lives, my friend,
And not only that, we want to make sure that people are eating right and exercise and get their immunity up, making sure they're keeping their bodies as healthy as possible. I think that plays a big portion. Like he said, make sure you wear your mask, get an N95 mask. Those cloth masks are not as good. They actually, stuff can get in between them. I've been reading up on it. Get an N95 mask. It's all possible. Make sure you wash your hands after every touching anything. Make sure you social distance. I mean, if a restaurant is not social distancing, don't go there. I know at my office, Smiles by Dr. Heavenly, we do all of the precautions there. We have the fumigator there. We have the humidifiers. We have an air purifier. We actually take the temperature on everybody that comes in. We don't allow anybody to wait on anybody else in the lobby. So only that person can come in, and we do require masks. And we have so many different protocols that we have to do to actually see patients as safely as possible. We even got a new rinse. I just read about it in the ADA, an iodine rinse that kills the coronavirus in your mouth. So the what do you call it? Droplets does not get in the air. So we're doing all we can to keep everybody safe. I'm so proud of my husband for Georgia Know Your Status, and getting people to know their results is so important. And my question to Dr. Damon is, hopefully you won't be, but if you're positive for COVID, what's the next step?
So the first thing is, if you have a primary care doctor, call your primary care doctor, let them know your status. Essentially, it's going to be a similar answer. Go home. Get into a place in your home where you can do everything you need to do. Stay away from your family. So if you have a basement or something that not everyone needs to walk through or something, you go down there. It's just, it's 14 days, and certainly that's a sacrifice, but it's really not when you're talking about the people that love you.
Do you need 2 negative test results in order to know for sure that you don't have COVID? Or I know at hospital they require 2 negative.
Most places of work will require 2 negative tests. In the healthcare field, we're not really going that far. There's physicians, we have to wait about 72 hours without having a fever. And then you can come back to work and stuff like that. And so, that's a little different from us, because we're essential workers and we got to be there. Yeah, it's not good, but there's not that many of us. But everyone else needs to stay home at least 14 days. Make sure you're not febrile anymore. Talk to your primary care provider. You can also access the public health department as well. They'll give you answers. But the main thing is Georgia, know your status. Come on out this Saturday, the 18th, from 12 noon to 5 p.m. And it'll also be a televised event. Also, if you have pain, come to Roswell Pain Specialist or Roswell Pain Surgical Center. If you've been in an accident, personal injury, we have attorneys as well. Special shout out to Brandon Dixon Law Firm. They are great. They take care of personal injury cases and they know what they're doing. And we work directly with them and a bunch of other legal professionals. But you can get your everything taken care of. Give us a call. The number at my office is 678-736-7680. GeorgiaKnowYourStatus.com. Roswell Pain Specialist. Our website is thepainpros.com. So if you need us, come on out. We observe all precautions for COVID.
Yeah. So guys, I don't know if you into this, but I want to say, recapitulate. We're at the World Congress Center, we're at World Changers Church International in College Park, the one on Burdett Road, 2550 Burdett Road in College Park. We'll be there Saturday, July 18th from 12 p.m. to 5 p.m. We'll be out there with Creflo, Taffy, we're filming Married to Medicine. Come on out, get tested. It is car tested. Jackie, Dr. Contessa, Dr. Scott, that's right. You got it, Dr. Damon, Dr. Heavenly. And we're going to get you tested. Make sure you register. Go to the website, GeorgiaKnowYourStatus.com/events, because we have all our events listed. And go ahead and register for the event so we know you're coming.
Changers. Yep.
I don't have to ask where to go or send anybody. I mean, you
right.
That. You did all that. But no, I'm really proud of you. I mean, I think it's the service that the community needs. Georgia Know Your Status is going to help heal our community because we need to have access to the truth for individuals to know their status. So Saturday, we want everybody to go out. The world changes, hang out with you, be filmed. And I'm going to be right here at my house same place I was last time I saw Dr. Heavenly.
Yes.
Dr. Damon, really proud of you, brother. So
thanks
so much for serving the community and providing this service to the community.
Yes, sir. We're happy to do it. We're humble that people regard us, and we're just here to serve, and we'll keep doing it.
All right. Well, we'll see you later. And I am Munson Steed, and thanks for coming to A Seat at the Table. We'll make sure and get an article up tomorrow, Dr. Heavenly, about this for Saturday as well. So
thank you.
You got it.
All right.
We'll see you. Give Dr. Jackie a wave and a warm hug like this, when you see her, because
I will. I
definitely
miss you
guys. I miss you guys. So we're doing Ride virtual too. So
okay. All right. We'll see you soon. Thank you so much.
No, but I'm sending you my coloring book. And I've got a new women's coloring book out. So it's coming you guys' way. And I'm
okay. I look forward to it.
No, you got to get you involved. So
yes,
for sure.
Just what's happening. Anyhow, good to see you guys.
Thank you, sir. All right. Bye-bye.
Hey, everybody out there, this is very important that you all know your status. If nothing else, know your status today. So for us here at the seat at the table, we want you to take the time to know your status, even if you're not in Atlanta. Go find out your status. If you're moving about without a mask, if you think you've been exposed, take the time to learn. I'm Munson Steed. This is Seat at the Table. We'll see you tomorrow. Peace. We good to go, bro? TJ?
Yeah, we good.
We good to go?